Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona. I just want to really briefly talk about a service that we provide in our clinic and let you know why it might be a good idea for you to have this test. So we primarily do pain management in our clinic, but there's many things that can cause pain to occur. A lot of times people will have inflammation in their muscles and joints and they really don't know why. In fact, it's pretty much known out there that everyone in the world's got food sensitivities. They just don't know what they are. So, really briefly here, this is right from a website here called Meridian Valley Lab. We use these guys to do our testing for us, and I just really wanted to kind of go to their website to show you some really brief things here. One of the things they have on here is about allergies, what they are, and what kind of things they can do. Now, I don't really want to talk about that, but what I want to do is I want to come down here to talk about the different types of reactions. There's immediate food reactions. So these are the type of reactions, for example, the most popular would be like shellfish and peanut, where let's say the throat closes up. Typically occurs within 3 hours of digestion. And what it does is it sets off something called an IgE reaction. And so that just means that there's lots of inflammation, lots of what are called histamines being released into the bloodstream. Now, we don't really check for those, but a lot of times we check for delayed food reactions and food allergies. What a delayed food reaction is a test for different types of antibodies here, as we see listed here: IgG, IgA, IgM, IgD. And what a delayed food reaction is, for example, you eat something and over a period of time it causes swelling, inflammation, whatever it may be, but a lot of times it goes unnoticed because it is delayed. It's hard for the patient to put two and two together of what's going on and why it's happening. So we check for this, but we also check for different food allergies. So we check for the IgE primarily in our clinic, and we check for something called an IG4. And now, what this will do is it'll tell you what you should and should not eat. If you go to another page on the same website, these are some of the symptoms that you may have. And you can see here they are very far ranging. But if you come down, and some of the most common things we see are going to be chronic back pain. We'll have fatigue. Very common. You will see someone being tired frequently when they have these food sensitivities or allergies. We have the digestive issues like the constipation, the diarrhea, abdominal pain, but we'll have things like joint pain. We'll have things like migraine headaches. Very common to have food sensitivities when you have headaches. We'll have issues with arthritis. We can go on and on and on. I encourage you to go read that. And what's happening with a lot of these people with arthritis is they have things that are exacerbating or making their arthritis worse. And a lot of times it's something that they're eating and they're just unaware. So a sample report of what this may look like. This is going to be like the test that we do in our clinic. And what you can see here is it makes it really easy. It tells you the things you should avoid, the things that are moderate or low. It gives you a nice little bar graph here. So it tells you exactly what you should and should not do. And if you just follow the recommendations on here, typically these patients, not only do they lose weight, but they feel like they have more energy, they have less headaches, and their pain is better. So if you have some interest in how this test works, if you have some interest in getting this test possibly done, then check out the link at the end of this video to find out how you can follow up with this. Thank you.